Good afternoon, ladies and gentlemen. Bon après-midi, tout le monde. This afternoon, cet après-midi, we will be having two people speaking on coronavirus. On va avoir deux personnes qui vont adresser COVID-19. Dr. Jennifer Russell, médecin chef hygiéniste. Dr. Jennifer Russell, Chief Medical Officer of Health for New Brunswick. And le Premier Ministre Blaine Higgs and Premier Blaine Higgs. Dr. Russell.
Good afternoon. Bon après-midi. So before I start today, I just want to talk about some feedback that I'm receiving about the messages that we're giving recently around people staying at home and trying to flatten the curve. I do hear of people still gathering in large numbers and going out and about when they really should be staying at home and heeding these messages. We are trying to protect the public. We're trying to protect our resources. We're trying to protect our healthcare workers. We want New Brunswickers to stay safe, and we want them to stay at home. So as all of New Brunswickers are aware now, the spread of COVID-19 coronavirus is a serious health threat. It is a global pandemic which is being fought on many fronts, but the most important one is in each of our homes, where we have the opportunity to slow the spread of the virus, reduce the illness, and save lives. New Brunswick is not immune to the spread of the virus. As of today, we have 11 confirmed and presumptive cases, which includes 3 new cases identified in the last 24 hours. The 3 new cases are a female between 60 and 70 years of age in Zone 1, which is the southeastern part of the province, who had been on a cruise. A male between 60 and 70 years of age in Zone 3, which is the central part of the region, the province, who had been in contact with an individual who had direct contact with a traveler. And a female between 50 and 60 years of age in Zone 3 who had traveled to the United Kingdom. Le Nouveau-Brunswick n'est pas à l'abri de la propagation de ce virus. À ce jour, nous avons 11 cas confirmés et présumés, dont 3 nouveaux cas décelés au cours des dernières 24 heures. Une femme entre 60 et 70 ans dans la zone 1, région sud-est, qui est allée en croisière. Un homme entre 60 et 70 ans dans la zone 3, région centrale, qui est entré en contact avec une personne qui a été directement en contact avec quelqu'un d'autre qui avait fait un voyage. Une femme entre 50 et 60 ans dans la zone 3, région centrale, qui a fait un voyage au Royaume-Uni. It is imperative that we each practice social distancing for the sake of ourselves, our friends, families, and neighbors. And also for people we may not know directly, people who are vulnerable to the virus, as well as our healthcare professionals who are striving every day to slow the pace of this disease. Today I want to speak about the role we can all play in flattening the curve. And there are 2 images behind me, one in French and one in English, just showing the graphic of that, whereby you see the dotted line represents our healthcare capacity. The higher peak represents people not following the measures that we have in place right now. And if you see the lower curve, you see that if we're all following these practices and playing our role and taking this very seriously, our responsibility, our civic duty, we can flatten the curve and take the pressure off our healthcare system and our healthcare providers and decrease the number of cases and deaths that we will see in this province. It is up to us to take actions that will slow the spread of the virus and give our doctors, nurses, and other healthcare professionals the best chance to cope with its impact. Ce virus se transmet par des contacts étroits. Plus le nombre de personnes qui entrent en contact entre eux est élevé et plus les contacts sont étroits, plus le risque de propagation du virus est élevé. The virus is spread through close contact. The more people and the closer the contact, the greater the chance that the virus will spread. If we reduce our contact, the immediate spread of the virus is hampered, as the virus can and will spread quickly if given the opportunity. Our aim is to slow this down so that the number of cases is spread over a longer period. This won't be resolved quickly, and all of our actions must be geared to reducing the spread of illness. We have asked that New Brunswickers stay at home, and I offer my thanks to the thousands who are doing that. But this is not the time for house parties. Stay home. Restez à la maison. Ce n'est pas le temps d'organiser des rencontres d'enfants pour jouer. Stay home. It is not the time for teenagers to hang out with their friends. Restez à la maison. Ce n'est pas le moment de garder les salles de bingo ouvertes. Ce genre de choses peut contribuer à la propagation du virus. We must take responsibility for our actions. Please stay home with your families and limit your contact with others. When you must be in contact with others outside your home, try to stay at least 2 meters apart from other people, or 6 feet. Make sure you wash your hands frequently with hot soapy water, or if you have access to alcohol sanitizer, you can use that as well. But the research shows that the hot soapy water actually works the best, and there are many, many YouTube videos on how to do that safely and effectively. Coughing and sneezing into your elbow, disposing of your tissues when you blow your nose. What's happening right now in Canada, in the world, in New Brunswick is unprecedented in history. I was speaking with the Premier before I came in, and in 1918 there was the Spanish flu that went around the world globally. And at that time, New Brunswick had about 350,000 residents. And in 1918, 1 in 4 New Brunswickers died. And that was actually a better case than happened elsewhere. And the types of measures that we're instituting right now actually were instituted in 1918. And it was actually at the advent of the beginning of public health and the Department of Health here in New Brunswick. So, 100 years ago, we were living something like this. None of us were alive back then. So this is unprecedented in our lifetime. And it is very serious. And we all have to work together. We've never been through something like this before. Je félicite chaque citoyen Nouveau-Brunswick qui passe à l'action afin de nous aider à relever le défi qui se présente maintenant à nous. Si vous êtes inquiet et anxieux, n'oubliez pas que vous n'êtes pas seul. These are stressful times, and we must all do our best to manage the stress we are feeling. And there are concrete things that you can do to look after yourself, to care for yourself and your family. Make sure you eat healthy. Make sure you get some balanced meals, get regular exercise, and get proper sleep. You can meditate, practice hobbies, and do things to help you relax. Vous pouvez discuter avec les autres et leur expliquer que vous ressentez d'une façon qui protège votre santé et celle de votre collectivité. It is important to stay informed, but we all have our limits. Know when to say when. Avoid information overload, especially on social media. And when you need help, there are resources available to you. Right now, your mental health is just as important as your physical health. And I'm going to say it again because it is really important. Your mental health is just as important as your physical health. This virus has the potential to overwhelm our healthcare system, our society, and every one of us. Cependant, il est possible d'éviter cette catastrophe. Nous pouvons ralentir la propagation et aplanir la courbe. Chacun de nous a le pouvoir de contribuer à l'effort de guerre. Le moment est venu pour nous tous d'exercer ce pouvoir. Merci beaucoup. Thank you very much.
Good afternoon. Bonjour. It's important that we continue to listen to the recommendations from Dr. Russell and her team at Public Health. People should stay home whenever possible. I can't stress that enough, and Dr. Russell has stressed it over and over again. Les gens devraient rester à la maison lorsque c'est possible. Je ne le dirai jamais assez. So what does that mean? That means don't go joyriding in full cars. That means don't find reasons to get together in the den and watch a movie with all your friends. It means do it separately with your family members whenever possible, but don't get all together. It means no play dates, no sleepovers. This is, as I said yesterday, this is short-term pain for long-term gain. This is not an exercise. This is not a hypothetical drill. This is reality like we have never seen before, and we must react. It's good to get outside and to get fresh air, but avoid groups when you do so. And if you need to go somewhere, such as a grocery store or pharmacy, keep 6 feet away from others. And if you see an old friend, the best way you can ensure they stay a friend is to wave and not go up and shake hands. It is only by taking these measures and taking this serious situation very seriously that we will be able to flatten the curve and reduce the impact of this virus. C'est seulement en adoptant ces mesures et en prenant la situation au sérieux que nous pourrons aplanir la courbe et réduire l'impact de cette virus. Some people have no choice but to be out. These are the people who are providing essential services. They include those on the front lines, doctors, nurses, and support staff. But they also include the truck drivers who are making sure goods get to our stores, the staff working in those stores and keeping the shelves stocked, and the people working behind the scenes every day to enable us to continue to get these important updates to you. We need to do what we can to help these workers stay healthy and safe, and that means staying at home as much as possible. Nous devons faire ce que nous pouvons pour aider les personnes qui fournissent les services essentiels à demeurer en santé et en sécurité. Et cela veut dire que nous devrons rester à la maison le plus possible. I know many of you have questions about daycare services and payments. To be clear, parents will not be charged while daycares are closed. Essential service workers will continue to pay the regular rate for the daycare services they are using. We are asking daycare operators not to increase their usual rates at this time. And today, the federal government announced relief for small businesses, and we are working to determine how this applies to daycares. But we are committed to closing the gaps. Though many businesses have temporarily shut down to encourage people to stay at home, our grocery stores and pharmacies remain open, and our supply chain remains strong. That will not change. Plusieurs entreprises ont fermé de manière temporaire pour encourager les gens à rester à la maison. Mais nos épiceries et nos pharmacies demeurent ouvertes et notre chaîne d'approvisionnement demeure solide. Et cela ne va pas changer. Overbuying is not necessary. All it does is cause more work for those working in grocery stores and pharmacies, and anxiety in those who are shopping before employees have had a chance to restock the shelves. For New Brunswickers who are fearing potential food insecurity, let me reassure you, the Department of Social Development is in constant contact with food banks, soup kitchens, and other agencies such as Meals on Wheels and similar organizations to ensure the continued provision of services. We have offered to provide financial and human resource assistance to any of those agencies who encounter difficulties during this period. Nous avons ouvert de soutien financier et de l'aide au niveau des ressources humaines aux organismes qui rencontrent des difficultés durant cette période. If some of the business closures lead to an influx of additional clients, we can help with financial support over and above what already is provided to assist in order to ensure we meet any increased demand. We are aware New Brunswickers who have been struggling with chronic homelessness are vulnerable to a virus such as COVID-19. The Department of Social Development is working closely with our homeless shelters to encourage best practices in preventing the onset and spread of the virus. There are contingency plans in place in the event a homeless shelter client becomes ill with COVID-19. Most shelters are operating at or near capacity, but we are finalizing plans to provide temporary separate accommodations in the event a shelter client were to fall ill. La plupart des refuges fonctionnent à pleine capacité, ou presque, mais nous préparons un plan pour offrir un logement séparé temporaire en cas où un client d'un refuge tomberait malade. We know it isn't just our most vulnerable who are concerned about COVID-19, as this virus has the potential to impact more than just our health. We are working at a provincial and national level to help those who need help, as are many businesses and institutions. Nous travaillons au niveau provincial et fédéral pour aider les gens qui ont besoin d'aide, comme le font plusieurs entreprises et organismes. The country's 6 largest financial institutions announced yesterday that they will provide relief to Canadians impacted by the economic consequences of COVID-19. They have committed to working with personal and small businesses and small business banking customers on a case-by-case basis to provide flexible solutions to help them manage through challenges such as pay disruption due to COVID-19, childcare disruption due to school closures, or those facing illnesses from COVID-19. As I mentioned yesterday, I called on the federal government to act with urgency to assist small businesses and individuals who need help. I am glad to see that they are taking the necessary steps to do so. Today, the Prime Minister announced a new set of economic measures to help stabilize the economy during this challenging period. These measures will provide up to $27 million in direct support to Canadian workers and businesses. As this was just announced, we will need to determine the role New Brunswick will play in this. Once we have more information, we will share that with you. But what we know is that you can access the Government Canada website directly and apply for and receive funding without delay. I am pleased that Canada and the United States have agreed to collaborate on mutual restricting discretionary travel across the border. I was also relieved to hear during a call with Deputy Prime Minister Chrystia Freeland and all the premiers that this will not impact essential travel and trade, including trucking. Specifically, we were given assurances that they will find a way to minimize the impacts on the residents of Campbell Island. New Brunswickers care about their families, their friends, and their communities. I know you want to do what is best for the health and safety of others, and we must all consider that with any decisions we're making now and in the immediate future. The best thing we can do right now is to stay at home, be safe, and be healthy. Les gens de New Brunswick se préoccupent de leur famille, de leurs amis et de leur communauté. Je sais que vous voulez faire ce qu'il y a de mieux pour la santé et la sécurité des autres personnes. Et la meilleure chose à faire maintenant, c'est de rester à la maison. We would not ask you to do this if the situation were not so serious. We have seen what happens in other communities, other countries, where social distancing measures were not taken, or were not taken until it was too late. We must ask that you listen to this advice now to protect the health of all New Brunswickers, especially our more vulnerable citizens. If people do not act as advised, we may need to take additional measures to ensure that everyone follows the recommendations from public health. Si les gens ne respectent pas ces conseils, nous devrons peut-être prendre des mesures supplémentaires pour nous assurer que tout le monde respecte les recommendations de la santé publique. We aren't there yet, but as a province and as a country, we will do what is necessary to keep residents safe. I'm asking that each one of you think about the role you play. We've asked this over and over again through these transmissions and these daily updates, but it is extremely important that this situation is not underestimated. The health and safety of you, your friends, your relatives, your parents, your grandparents, your neighbors depends on your direct action to help ensure that this disease does not spread widely through our community. Thank you. Merci.
Thank you, Premier. Merci beaucoup, Monsieur Premier Ministre. We have a limited amount of time, so we ask you pose your question quickly and mute your microphone, and if time permits, we will try to do follow-up questions. Première question. First question, Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering if all New Brunswickers who are on that flight from Toronto to Moncton have been informed and I guess have reached out to 811 or public health, and you've been able to begin that contact tracing.
So PEI is the lead on that particular, with respect to the contact tracing for that flight. And so they have contacted regional public health in the southeast, and they're working with the close contacts.
Thank you, Laura. Michel Corriveau, Radio-Canada. Michel Corriveau.
Dr. Russell, j'aimerais savoir, vous avez insisté beaucoup sur l'importance de rester à la maison. Est-ce que les gens respectent ça et que pensez-vous de déclarer un état d'urgence éventuellement?
À ce moment-ci, c'est ça, je reçois de l'information dans les derniers jours que les gens ne respectent pas les recommandations. Ça pose des problèmes parce que on a des cas, on croit qu'on va avoir plusieurs cas dans les prochains jours et semaines. Et le nombre de cas va continuer à augmenter si on ne suit pas les recommandations. On peut dire que les gens lavent les mains puis restent à la maison puis, et s'éloigner l'un à l'autre, mais si les gens ne prennent pas ces avis, ils ne suivent pas les directives, ça veut dire qu'on va encore avoir plus de cas. Puis la raison qu'on veut pas avoir plus de cas, c'est parce qu'on veut aplanir la courbe, on va protéger notre système de santé, on veut protéger nos travailleurs qui sont les médecins puis les infirmières qui vont travailler, puis on veut protéger la santé des Néo-Brunswickois.
Merci, Michel. Megan Yamoa, Global News.
Hello, I have a quick question and one quick follow-up. How many people have you asked to self-isolate due to potential contact with COVID-19?
Well, basically, we're telling the whole province to self-isolate right now.
Thank you. Andrew Waugh, Telegraph Journal.
I would like to ask the Premier, in addition to what the federal government is doing for a financial aid package, is New Brunswick going to have one too?
So I think, Andrew, right now we are analyzing the package that's being offered from the federal government. What we've been assured of in the discussions, both with Deputy Prime Minister Freeland and with the announcement of the Prime Minister, is that the package is going to be all-inclusive in order to address any shortfall that people are experiencing. We're seeing the aid, as I mentioned, from banks as well to minimize impact. I've spoken as well to the CEO MB Power in relation to the practice in MB Power, and so that's going to be addressed in the coming days. So what we will do as a province is we will put resources as necessary to ensure people are kept whole through this. Right now we're analyzing the federal package, and we'll determine if there are any shortfalls following that.
Thank you. Matthew Wacomo, L'Acadie Nouvelle.
Mr. Premier, you've just talked about the need to maybe take additional measures if people are not respecting social distancing. Could you tell us what are your powers in a case like that? What could be those measures, and if it was discussed at the special cabinet on COVID-19?
It has been discussed, Matthew, with our special cabinet group and the leaders of the other parties. It was also discussed this morning in a nationwide conversation with Deputy Prime Minister Freeland and my colleagues across the country. As you know, some provinces have already put those measures in place. I guess what for me is that we're having discussions with public safety about looking at our people closing. We have direct information, about different businesses, small businesses, and I know it's difficult to shut the doors. But they're basically, carrying on as business as usual. This is not business as usual. And so if people do not close their facilities voluntarily, based on our recommendations and our request to do so, then we will put the measures in place to ensure they do, because the safety of the general public is at stake. So right now, in our discussions this morning with Deputy Prime Minister Freeland, she asked, when I brought this up, she asked, what is the general feeling on the group? I'd like to hear from each of you individually. I've already expressed my concerns to her. I think we'll see the federal government continue to ramp this up, because this isn't a voluntary exercise, and people cannot consider it as such. So we will do whatever is necessary to ensure that compliance is part of this program. We cannot risk health, and we cannot do otherwise.
Thank you, Matthew. Silas Brown.
Dr. Russell, there's been a lot of focus today on flattening the curve. Are New Brunswickers doing enough at this point to flatten the curve, or are there more things that we all need to be doing at this point?
I think New Brunswickers really need to take this very seriously. So if they aren't already doing all the things that we've recommended, they should probably start now. I think it's hard for people to get that message necessarily, because it doesn't seem perhaps completely real to them at this point in time in terms of the power that they have to control some of the situation. So each individual person in New Brunswick does have a role to play, and they do have the power to have a positive effect in this situation. So if you can stay home, you should stay home unless you're an essential worker.
Thank you. Shane McGee, CBC.
Dr. Russell, we're hearing reports of healthcare workers going back to work after returning from international travel without self-isolating for 14 days, even hearing that they are being instructed to do so. What can you tell us about that?
Well, that would be with the individual employers, and so usually the regional health authorities are dealing with that, but it's at the employer level.
Thank you. Jacques Poitras, CBC.
Hi, Dr. Russell. Can you tell me what people should do if they have to make an essential trip, such as the grocery store? Are there extra steps? How long does the virus stay on packaging? Should people wash their clothes?
So there's different information out there in social media and other places around that, and I don't think anybody's landed on one specific time frame, and it's different for different services. So my advice would be, if you have to go out to do grocery shopping, obviously for seniors and whatnot, they have actually, they're opening their doors for that first hour for just senior citizens, which I think is great. Because that allows them to shop before other people are there. So definitely shopping when there's not a lot of people around, making sure you wash your hands, and people suggest actually wiping down, whatever things that you do end up buying. Social distancing while you're out, so stay 6 feet away or 2 meters away from anybody else. And so those are the types of situations where if you do have to go out to get groceries and things like that, those are the steps that you can take. And obviously washing your hands with hot soapy water or using a disinfectant.
Thank you, Jacques. Holly McKenzie Sutter, Canadian Press.
Hi, question for the Premier. Talking about plans for temporary accommodations in case a client in a shelter falls ill. Can you clarify further about whether that would mean potentially opening more shelters or specific rooms, and I guess what kind of spaces we're looking at for that?
I think what I would state on that is that the social development have now a procedure in place that should anyone in a shelter be identified or come in with symptoms and be tested, they will be taken from that shelter and be put in an alternate location. Social development had put that procedure in place, and then the following protocol after that to test others would be in place. But we have a system now. The question had been asked earlier. And social development now have a policy in place to deal with that.
Thank you. Elizabeth Fraser, CBC.
Hi, Dr. Russell. Yesterday you announced that patients could book virtual appointments with their family doctor. Those without family doctors, what should they do? Should they continue to visit medical clinics?
I think they should be calling 811. So people who have symptoms should be calling 811, and if it's emergency, obviously call 911. And if you have other questions than that, there's information on websites and whatnot. But and we are working with the New Brunswick Medical Society as well on how to provide services to people who don't have family doctors.
Thank you. Vicki Hogarth, Charlotte County TV.
Premier Higgs, does public safety now warrant more disclosure of municipalities, or at very least the counties, in which New Brunswick coronavirus patients live? Can we get more specific than just the zones at this point?
So the measures that we're putting in place are really around making sure people stay home and don't transmit the virus. We know that COVID-19 has an incubation period of between 1 and 14 days. We know that when people exhibit symptoms and they get tested and we do the contact tracing, that once we contact the close contacts of those cases, it could be that they've already exhibited symptoms and they haven't been self-isolating, then people can be exposed. So, and this can happen anywhere in the province. So that's why the message is the same no matter where you live in the province. Stay at home.
Thank you very much, ladies and gentlemen. Merci beaucoup. Do this tomorrow. Thank you.